Hey guys, welcome back. This is part 2 of rehabbing the hips. We are going into passive ranges of hip internal and external rotation, and then we're working isometrics in those passive ranges to start to build capacity in those ranges, and so that you start to own those ranges of motion so that you can get back to your activities without pain following your injury or surgery. So this is a progression from part 1, which is all lying down. We're doing all of these movements standing up. We're just going to do external rotation on both hips, internal rotation on both hips, and call it a day. We're working somewhere between 5 and 10% of our max range for an extended period of time. So I want you to find the tissues that are involved in these articulations. We're just trying to actively work those isometrics, but not to the point of overexerting yourself. All right, keep that in mind. So let's start with external rotation with the right leg. So I'm using a bench here. A setup that you can adjust is ideal. We're going to be able to get into our end range stretches easier and a little bit more passively. If you don't have a bench like this, a chair works well. You can grab even a flat bench and some yoga blocks. We're just going to be propping the knee up and the foot will kind of go below that. So adjust as needed. Use what you have, and let's get started. So I also have a stick for stability here that will also take some of the work out of balancing in these stretches so that you can focus on the stretch more than the balance. So let's start with external rotation first of that right leg. So if I'm facing the bench, here's my 12 o'clock out in front of me, right? So using the clock system, we're going to work these rotations in different angles. So I'm going to place my right leg in front at 12 o'clock. My knee is going to be right in front of the hip. Knee is bent at 90 degrees. We want the knee to be below the hip and the foot to be below the knee, right? So we want to be able to get the knee down onto your support. So if the knee is up here or if you're on a flat surface, bring a yoga block underneath the knee and then slowly stretch and shift into that rotation by pressing the knee into your yoga block so it does have something to push into for our stretching and our isometrics. Okay, so I've got my knee below my hip, foot below the knee, and I'm stretching here. So we're just gonna kind of pitch forward over this position if we can, just slightly working into that rotation. So we wanna keep that right foot flexed. Support can be in either hand or you don't even have to use the support, but we're gonna pitch forward, trying to drive the right hip back away from the right knee. And we're gonna tip our tailbone out behind us as we pitch forward just slightly and then push the leg down into the bench to come back out of that. Let's do that 2 more times. So we're kind of working into the groove here. You can of course hold on to the bench as well. And then we're gonna push down to come back out of it. And let's do 1 more. Now, if you were able to stretch forward and you feel like you got a deeper stretch in the hip, then we're gonna pause there. You're gonna shift back into that stretch, and that's where we're gonna work from for these isometrics. So we're holding this external rotation stretch, and then we're gonna work in those 5 to 10% ranges. First, we're gonna push the leg down into the bench. So nothing's actually moving in these isometric contractions. We're just trying to crush the bench. And we're only using 5 to 10%, so it's very unlikely that we're actually going to be able to crush through it. But that's the direction of our force that we're producing. And then as we exhale, let's reverse that. You're going to try to lift that leg up towards your chest. Now, don't just lift the knee, okay? I want the initiation to be from that heel coming up towards the left shoulder. So once again, this is isometric. Nothing should actually be lifting. If you can lift up, then I want you to get further into that stretch until you cannot lift up. And then you're gonna release the tension. See if we can get a little further into that stretch. Now that we know that we're not actually gonna be moving anything, we can take a risk and push a little bit further if that's not painful. And let's do that again. Push down into the bench. Keep pushing down for 5, 4, finding the tissues on the outer part of that right hip, pushing down. And now let's reverse it. Finding tissues on the inner part of the right hip and thigh, trying to lift that right heel towards the left shoulder. 5 to 10%. 3, 2, 1. Release the tension. See if we can get a little further into that stretch. And let's go one more time. Drive down into that bench. We're creating space in the hip capsule here with these progressive isometrics, progressive tissues working the outside of that hip. 3, 2, 1. Reverse, trying to lift up even higher, trying to get into that stretch actively. So we're actively trying to pull further into that articulation of external rotation. 3, 2, 1. Release the tension. Come on out of it. So we'll stay in this position and now open up your body from 12 o'clock to 10 o'clock. So your body's turning towards 10 o'clock. The leg is staying right where it's at. And then we're going to stretch forward into this external rotation in this position. So now the leg has a little more external rotation to it and some abduction from the hip. So we're going to press down into that knee with that right hand, and we're going to try to pitch that body forward just slightly, just like we did before. But if staying up here is really a good stretch for you, then you could just stay in that same position. So once we're forward, we're going to do the same isometric. So we're going to push that foot down into the bench as if that right knee is going to come up into the right hand. Now the right hand is going to prevent that knee from lifting. We're driving down with that foot and shin. 3, 2, 1, and then we reverse that, driving the knee down, trying to pull the foot and the shin off of the bench, actively using that 5 to 10%. Like you're trying to rotate further into that stretch. Try not to let that push the body upright. And then release the tension. See if you can get a little further into that position. Take a breath, and then we're going to do that again. Push the foot down into the bench as if we're trying to internally rotate out of that stretch. Keep pushing actively, driving down into the bench. 5 to 10% for 3, 2, 1, and reverse it. Drive that knee down and try to lift the foot and the shin up towards your chest. Keep lifting and rotating from that hip for 3, 2, 1. Release that tension. Try to get a little further into that position. And let's go one more time. Drive down into the bench with that foot and shin. Make sure that that left foot is active and left leg is active, and driving that stick or your support down into the floor as well. And then reverse. Try to pull that foot higher. Pull it away from that bench without letting anything else move for 3, 2, 1. Release that tension. Then we're slowly going to come out of that position and do all of that on the left side. So we're going to set up just like we did on the right? We're facing our bench or chair. That's our 12 o'clock position with the torso. Left knee is right in front of that left hip. We're bent at 90 degrees. Left foot is flexed. And then we're going to shift forward into this stretch. So we're going to pitch forward just slightly, tipping that tailbone out behind you, lengthening the outside of that left leg, trying to drive the left hip away from the left knee. Then push that foot down into the bench to come on up. We're preparing those tissues for the isometrics that we're going to be doing in just a minute. Pitch forward as you come up, drive that foot down. And then we're going to do that one more time, pitching forward, lengthening that position. Push down to come back up. And now if that stretch felt really good, we can work in that position. So we're getting to that end range. Breathing into that stretch. Make sure that the spine's not rounded here. Spine should be nice and long. And let's get into our first isometric. So we're pushing down into the bench with that foot and that shin, trying to internally rotate out of that position, but that knee's not going to go anywhere. 3, 2, 1, and reverse it. Try to drive the knee down, but lift the foot and the shin further into that position. Now we're feeling the front of the hip, deep in that hip capsule, the inner thigh trying to rotate. 3, 2, 1. Release that tension. See if we can get a little further into that stretch. And let's do that again. Push down into the bench like you're trying to internally rotate out of that stretch. 5 to 10%. Keep breathing here. We're just trying to find the tissues on the outer part of that hip. And then reverse it. Try to drive the knee down, but lift that foot and the shin, trying to lift that left heel towards the right shoulder. But again, these are isometric contractions, so If you are able to lift that leg, then I want you to get further into that stretch and then release the tension. Try to get a little bit further into it. And let's go one more time. Push down into that bench with that left foot. Right? We really want to get into our end range here. We know we're not going to be able to lift, so we want to push, 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 see how far we can go into that stretch, and then reverse it. Try to find the tissues on the inside of the thigh and the inside of that hip capsule. 3, 2, 1. We're going to release that tension, slowly come up out of it, and then we're going to rotate the body towards 2 o'clock. Okay? I'm going to press into that left knee with my left hand. I'm going to pitch forward slightly to get a deep stretch in that external rotator of that left hip. And then we're going to do our same isometrics here. So now let's push into the floor with that left foot and shin. You might find that you can get a little more force produced out of this position with the leg slightly abducted. So use that and then reverse it. Try to drive the knee down, lift that foot up towards your chest. Keep going for 3, 2, 1. Release the tension, getting further into that position. Take a breath and let's go again. Push down into that bench with that left foot like you're trying to lift that left knee. Keep pushing. We're still working in that 5 to 10% range, just trying to find some activation in the muscles and tissues. And now let's reverse it. Drive the knee down, lift that foot and that shin. Imagine that femur rotating within that hip joint. 3, 2, 1. Release that tension. Get a little further into it. Let's go one more time. Push down into the bench with that foot and shin. Like you're trying to internally rotate out of that position. 3, 2, 1. And reverse. Drive the knee down. Try to lift that foot and the shin higher. Of course, it's not actually going to go anywhere. Keep that in mind. 3, 2, 1. Release the tension, slowly come out of it, and slowly bring that leg down. So let's get into some hip internal rotation. So now I'm going to work as if my 12 o'clock is in this direction. So if I'm facing, my right leg is on the inside next to the bench, facing this way, that's my 12 o'clock. The knee is gonna go out to somewhere between 2 and 3 o'clock. Now, if we need to lift the knee up a little bit higher, that works as well. You can put a block under that knee. If we want to go into more internal rotation, you can place a block underneath that foot, right? But we want to find a position that we can stretch into. Now this one, we're not going to be rotating or pitching the body at all. We just want to be as upright as possible. So you want to try to get your body from this pitched forward position into an upright position. And if we are in that upright position and you don't feel a stretch, then I want you to grab your block and place it underneath that foot. That way we are in more internal rotation. Okay. So from here, we're driving the right hip forward. So that right hip is driving forward, glutes are engaged. That's gonna stretch out the front, the inside of that hip capsule. That's what we really wanna feel here in this position. Keep that hip underneath you as we drive that foot into the block or the bench. Again, we're trying to come out of that position, but this time we're trying to externally rotate out of that position. Of course, that right knee is not going to go anywhere because you're going to make sure that it doesn't. Hold that. We're going to feel the outer part of the hip trying to lift that knee, and then let's immediately try to reverse it. So now try to drive the knee down and try to lift the foot up. Keep lifting. Again, we're feeling the outside of that hip working to rotate more. And release. Now, if you need to get further into that position, like I was able to lift my foot, I need to get a little more into that internal rotation. Take a deep breath and let's do that again. Driving down at that 5 to 10%. Keeping that right hip underneath you, glutes squeezing. 3, 2, feeling a stretch across the front of that hip, and then reverse it. Trying to internally rotate that thigh to lift the foot higher. Keep trying to lift for 3 without pitching forward, and release the tension. I'm actually going to come up this way so that my knee is a little bit higher and my rotation is even more than that. And we'll go one more time, driving down into that block, really feeling the front and top of that hip pushing, pushing, pushing. Glutes up here working to drive down. Keep pushing for 3, 2, 1, and reverse that, trying to lift up. Drive the knee down into the bench. Try to lift that foot higher. 3, 2, 1. Release that tension. Now we're going to stay in this position, but I want you to turn your body towards 2 o'clock, right? So now we are intensifying the internal rotation just by turning the body towards that 2 o'clock position. Now we still want to drive that right hip away from that right knee. And now if we want to pitch forward for a deeper stretch, we can do that here. It's going to be a very small position, very small pitch forward. So now let's do our isometrics here. We're going to push down into that block or that bench with that right foot as if we're trying to lift that right knee up. You can reach that left hand across so that that does not happen. 3, 2, 1, and reverse it. Try to lift that right foot, driving that right knee down into the bench. Keep lifting. 3, 2, 1. Release that tension. Try to get a little further into that stretch, and let's do that 2 more times. Drive the foot down. So as I'm driving down, I'm really feeling a deep stretch in the inner capsule of my hip, right? That's exactly what we want, but we want to make sure it's not too intense, okay? 5 to 10%, and reverse it. Drive the knee down, lift that foot in the shin. Keep going for 3, 2, 1. Release the tension. See if we can get a little bit further into that stretch. And let's do that 1 more time. Drive the foot down into the block like you're trying to lift the knee, push into that left hand. Keep going for 3, 2, 1, and reverse. Trying to lift that foot and shin, driving that knee down. Keep lifting, 5 to 10% for 3, 2, 1. Release that tension. Slowly come on out of that position. Very slow, very slow. That hip internal rotation gets really deep into that hip capsule. So let's do that on the left hip. So we're going to set up our internal rotation. Ideally, just like the external, you want the knee to be lower than the hip, the foot to be lower than the knee. Unless we feel really good in that rotation, then we can lift that foot up or even lift that knee up a little bit higher. We want those hips to be pulled underneath you so we feel a stretch across the front of the hip and deep within that hip capsule. Okay, so we're finding that stretch here. Taking a breath into that position. All right, so let's start our first isometrics. We're driving down into the block with that left foot, trying to lift that left knee up out of that rotation. Keep pushing. We're feeling the outer part of that hip working to drive down. 3, 2, 1. And now let's reverse it. Try to internally rotate that femur more. Trying to lift that foot and the shin up. Working at that 5 to 10%. Feeling those hips. Try not to shift those hips back. 3, 2, 1, release the tension. Try to get a little further into that stretch. Make sure those hips are pulled all the way underneath you. And let's go again. Drive down into that block or the bench with that left foot, trying to externally rotate out of that position. Keep driving down. We're creating space in that capsule. 3, 2, 1. Now use that space for more internal rotation. We're finding the tissues to actively rotate that femur within that hip even more. Again, if we're able to lift that foot up, then you want to make that rotation a little bit more intense and release the tension. Take a deep breath and let's go 1 more time, driving down into the bench or the block with that left foot. Feeling a deep stretch across the front of that hip and within that hip capsule. 3, 2, 1, and reverse. Lifting up into that rotation, trying to actively pull further into that stretch without letting the hips sink back. Keep them underneath you. 3, 2, 1. Release the tension. So if where you're facing is 12 o'clock, we're going to turn the body towards 10 o'clock. We're getting a deeper rotation stretch here. And we're pulling that leg across the body. So like we worked abduction away from the center of your body with external rotation. Now we're working adduction, pulling the leg towards the center of your body with internal rotation. We want to try to drive the left hip away from that left knee and see if you could pitch forward a little bit without hiking that hip up. Okay, so from this position, this is a really intense stretch, okay? Deep within that hip capsule, we're working 5 to 10% of your max effort. Drive down with that left foot. Trying to push into that right hand, externally rotating out of that stretch. 3, 2, 1. Now reverse it. Try to drive the left knee down. Try to pull that left foot up. Try to pitch that chest even further forward towards that left leg. 3, 2, 1. Release that tension. Take a breath. And let's do that again. Drive the foot down into the bench or that block. Like you're trying to externally rotate out of that stretch. 3, 2, 1. And reverse it. Try to drive the left knee down, lifting that left foot up. It's all in the intention here. Even though nothing's moving, we are working. And release the tension. And let's go one more time. Drive the foot down. We're creating space in that hip capsule here. Keep driving down with that foot. 3, 2, 1. Try to reverse it. Drive that knee down. Try to lift that foot up. This is your last one. Feel that inner hip capsule. Feel the outer part of the hip trying to lift up, 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 up. And release that tension. Slowly, very slowly come out of that rotation. Awesome. So even if we were barely able to find some tissue and muscle recruitment in those passive ranges, just getting to that passive range and being there for an extended period of time is going to immensely help your rehab and recovery process. So keep working at it. Eventually it will become much easier and eventually you'll increase your range of motion. And when it's time to get fully back into your activities, you'll be able to use that range of motion and move pain-free. If you have any questions about any of this stuff, drop them in the comments below, and I'll see you next time.